rather than going to the emergency room, it's important to, number one, see your established primary care physician in the clinic. Most of our clinics try to provide some opportunities for Sunday appointments. If you can't get into your clinic, the next step would be to go to an urgent care. And so we do offer an urgent care in town. And then, of course, if your issue is life-threatening, go to the emergency department. So we try to offer same-day services in our clinics. And of course, we have an urgent care. And that's where you should go to decrease your healthcare costs. So there's three other options, one being lab services. And if you are registered as an outpatient at Great Plains Health, we have outpatient lab pricing, which is substantially lower than hospital pricing. The high cost for lab services is when you have to staff it 24/7, 365, have all the equipment here where you can provide stat lab services. So if you're in the emergency room or an inpatient, those costs are higher because it costs a lot more to staff this 24/7. If you need surgery and you're fairly healthy, it's better to have your surgery done at the surgery center. We have an independent ambulatory surgery center, ASC, in conjunction with our physicians. And so if you're in fairly decent health and you need basic surgery, it's important to choose the ambulatory surgery center over the hospital because the costs are lower there. And this year, what we've done, and we've done this over the last 2 years, is our imaging center. So we have an outpatient imaging center. Some of the feedback we would hear in the past is, I can go to imaging center in Lincoln and get an MRI for $1,000 and be charged $3,000 at the hospital. Now, an imaging center doesn't have to take care of anyone regardless of their ability to pay. They don't take charity care, they don't take Medicaid. So that's why they can price their services lower. But what we've done, and the only community our size, is we've actually priced our imaging at the outpatient imaging center substantially lower. So last year we decreased it about 30%, and then this year we decreased it an additional 50%. And so looking at like a net CAT scan, for example, through the hospital, the gross charge is around $2,800. At the imaging center, it's about $600. So avoiding the ER, outpatient lab services, outpatient surgery services, and outpatient imaging services are all something that you can stay here for and have the same pricing that you could find in that. So we're pretty excited about that as well.
And can your primary care physician help you navigate these different options? I know too, sometimes your primary care physician can help you with maybe a generic medicine rather than a name brand. So can the same thing be said in navigating this different price structure that you mentioned, Ivan?
Yes, that's where a lot of our education has been done, because most people go where their physician tells them to go. And so our physicians know this. And, if you're in that deductible or high out-of-pocket costs, they're going to make sure they get you to the appropriate level of care. Now, obviously, you're not going to shop where you have a heart attack or where you have a stroke. You're going to go to the closest place or have a trauma. But for those services that you can shop, we have those options and opportunities based here in North Platte, which we're really excited about.